I'm Dr. Rob Stevens. I'm one of the emergency physicians and family medicine doctors in the community. I started here as a staff in August of 2022, and I did a couple of residency placements with Dr. Zafar and the group here before that, so between 2020 and 2021. The big thing is that it's sort of unpredictable. There can be a lot of variability and variety, but usually I come in and get a warm welcome from the rest of the group, and then figure out if we're working with some residents or medical students that day, and then get to work, start picking up charts and seeing people. We work as like a triage system, as you know, so we'll see the sickest people first, or the people that have been waiting the longest, and then we work through and try and make people feel better and get a plan to figure out what's going on and get them where they need to go. As the physician, we're sort of like the point person. So the team will bring us information. They'll do an initial assessment and we get vitals and everything for us. And then we'll start coming up with a plan and orders. It's a team-based sport in emergency medicine, so it's a lot of information that we get from the nurses because we can't be at the patient bedside the whole time. And we'll make adjustments and decisions based on what they bring us. And then obviously as we're transitioning people in and out, we've got our like allied healthcare that will get involved. We got our gem nurse, we have social workers that come through, and then we have like EVS that comes and changes the beds and make sure the rooms are clean and safe for the next person to come in. So it all needs to work together as a well-oiled machine in order for it to keep moving. And my job basically, as I said, is like the sort of the point person for all that. I think most people know, but the big thing is like it's emergencies first. So everyone that comes through the doors, like we care and we want to get them feeling better, and we want to figure out what's wrong with them and address their issues. Sometimes things take priorities if people are really sick, but we do respect people's time and we value it, and we respect them as people. So if they're waiting for longer than they want to be or think that they should be, there's usually a reason for that. We're working hard to keep the department flowing. Some things take priority. There is, yeah. So there's a few, but one that I thought of recently was a patient here who's pretty involved in the community. A family member actually worked at the hospital as well. And what's fun about our hospital and our community is you can sort of be involved to a level of training and what's safe all over the place. So as a family doctor, I've worked as a hospitalist here and in the emergency department. Had a patient come through that I saw in the emergency department, and the next week I was on hospitalist, and the gentleman unfortunately was very sick and near end of life. But it was memorable and nice because he knew most of the staff there. A community like this, you're treating your neighbors, and that's basically what the vibe was with this gentleman. He did end up passing, but we were able to give him a really good last few days. We actually had, just with his involvement in the community, the fire department actually came through and gave him a little shout out, a little send off while he was in his patient room here, and that was really memorable. So that was fun. I mean, it feels like home. Like you're treating your neighbors, and you're treating people that are close to you, people you might see out at the grocery store, people that live by or that you might interact with, like playing hockey or sports or anything like that. So it feels closer to home for that reason, and that's really important to me. Yeah, I'd say do it. I've had a great experience. The team is amazing. The community is amazing. The hospital is great. We're about to get new facilities. The community's outgrown the hospital a while ago, and everyone in the community is excited to have a new space, a new facility, and hopefully that draws in more providers and makes those community bonds even stronger.